COVID vaccine is a snippet of genetic material that allows your body to produce a protein. This protein's foreign, and you develop antibodies to that protein, and thus you have protection against the COVID virus. So currently, there's only one type of COVID vaccine, and that's an mRNA vaccine. We will have other types available in the future. The Pfizer and Moderna vaccines available currently are both mRNA and work the same way. Both the Pfizer and Moderna vaccines for COVID are given in a series of 2 shots. One's 3 weeks and one's 4 weeks apart, but they both require you to get both vaccines to be fully vaccinated. Now, the first vaccine, you're not going to notice anything. The second one, you may have some side effects in vaccine response. The vaccine responses are the body aches, the fevers, and the chills. These are completely expected and should resolve within a day. There's very few restrictions on the current COVID vaccines. Essentially, if you have an allergy to the components of the vaccine, you should not take it. If you've had adverse events to food, other vaccines, or other drug allergies, it's safe to proceed to take this vaccine. Currently, we know about 3 months of data as far as the vaccine efficacy, and it's at 95%. The studies are still ongoing and will continue for 2 full years to tell us full efficacy as well as how long immunity lasts. If you have allergies to medications, drugs, or other substances, it is fine to proceed with this vaccine, unless you have an allergy to one of the components within the vaccine. Then please speak to your provider before proceeding to get vaccinated. If you're pregnant and wishing to proceed with a COVID vaccine, please speak to your provider. The current recommendations are to proceed with getting vaccinated. The first important thing is to recover from your COVID infection. This should take about 10 days for most people. At that point, you can proceed with your second dose of COVID vaccine. However, you cannot get the second dose before the beginning of your preferred window period. After vaccination, you're 95% less likely to get COVID infection. However, because it's not 100%, you still need to watch your distance, wear your mask, and wash your hands. If you've had COVID-19, the important thing is to recover from your infection. We're asking people to wait 30 days before you start your vaccine series. However, if you received therapy, plasma, or monoclonal antibody, you must wait 90 days from receipt of those medications before you get vaccinated.
Participation in getting the vaccine is critical. It's going to help us get things under control. It's important for us as team members, as our workforce, as we take care of patients, but we're also members of different communities, and it's important that for our communities we get vaccinated as well. Wellstar Center for Health Equity has multiple lanes that we're working in, but with respect to the vaccine, we're helping our partners with our workforce, getting word out about the importance of vaccine and dispelling some of the hesitancies that some of our workforce and team members have. Number 2, with respect to the community, we're all aware of the disproportionate pain, in particular that communities of color and underserved communities have had. They've had more infections, more hospitalizations, and more deaths. So our work is also centered around getting word out to these communities about the importance of getting vaccinated, but helping to dispel some of the myths that exist that drive the hesitancy.
So the COVID-19 vaccine was developed like all other vaccines are developed. There are natural stages and processes of vaccine development, and it followed those exact same processes. So the COVID vaccine was studied just like every other vaccine. It went through phase 1 study, which is safety and toxicity in a small, healthy adult population. Phase 2 study, which is a larger population, continuing to study its safety. And phase 3 to the thousands of people that have been under the study to make sure that you create the immune response. In Moderna and Pfizer, we've seen 70,000 participants in those trials. An EUA has its origins in 9/11, where the country came together and decided that the FDA process needed to be streamlined so that we could bring emergency use devices, vaccines to the table. In order for an EUA to exist, it has to be an emergency, a life-threatening event happening. The intervention has to be safe, effective, and the benefits have to outweigh the burdens. The COVID vaccine has met those criteria. Absolutely, the COVID vaccines are safe and effective. The FDA brought in the top scientists, like bringing Michael Jordan to the basketball court, to evaluate whether these vaccines were safe and effective for the country, and they all confirmed they were.
As one of the state's largest health institutions, the CDC, the DPH rely on us to store, distribute, and administer the vaccine. Wellstar follows the guidelines from the DPH and CDC on the various phases that are made available to us on how to expand vaccinations. Currently, we are in phase 1A of our group. I'm hopeful that in the upcoming weeks that the state and DPH and CDC will expand the different phases, making the vaccine available to the general population. Everyone who works at Wellstar is able to schedule their first dose through eSource via the scheduling app that's linked within. For a few more weeks, vaccinations will be available at the hospitals, from which then they will transition to the health parks. For the second dose, you will automatically receive an email or a text with booking instructions. A question that we get a lot is when family members can actually receive the vaccine. Currently, we're in phase 1A of DPH and CDC's recommendation. That allows for family members over the age of 65 and older to receive the vaccine. I'm hopeful that in the upcoming weeks that the phases will evolve and the vaccine will be made available to all family members. A question that we get a lot is if we need to stick with the original manufacturer for the second dose of the vaccine. In the rare event that there is not sufficient inventory for the second dose, the recommendation would be to stick to the original manufacturer and get the second dose when the opportunity is made available.